I'm sure I will understate all of the research going on at MSK because there's so much, but we have a formal CLL program with several investigators in our leukemia and our lymphoma services, really aimed at designing clinical trials that are focused on patient problems. And so our clinic is often our laboratory. We listen to our patients, they tell us what their problems are, we observe where therapies are failing, and then we've designed several trials frontline and in the relapse refractory setting to address those questions, all the way at looking at stopping novel agents. So we have 3 trials that are in the works that will allow us to discontinue certain drugs based on depth of response, new combinations that are, we feel, clinically relevant, looking at new classes of agents in CLL like bispecific antibodies, non-covalently binding BTK inhibitors, focusing or refocusing efforts in CAR T. And so altogether, we try to have a clinical trial option that's relevant for most patients that we see, recognizing full well that there's also a wealth of standards of care that are approved that also work quite well for our patients. So either way, we have expertise in terms of clinical research or management with standard agents. And I think to be determined, it's really based on events and based on enrollment. So it's not sure what we'll present at ASH next year, but I'm certain we'll have something to present.